This is Midday Mobile with Sean Sullivan on FM Talk 106.5.
All right, welcome back, Midday Mobile on this Friday. And you'll recognize this man's voice when he comes on with AltaPointe. Dr. Luke Engeriser comes in talking about a lot of issues just affecting civilians here in our area and what AltaPointe's doing. But what y'all might not know is his backstory and his service to our country, doing this for our fighting men and women. Thanks for coming back in.
Thanks, Sean, for having me.
You know, on this Veterans Month, we talk about the issues facing veterans, and it's not just the one thing. I mean, there are a bunch of them, but we have stats out there. I think the stat that is 22 veterans take their life every day, but that, my friends tell me that's actually a low number for what's really happening out there.
Yeah, it's really a tragic thing. You know, veterans are about 7% of the population, but they make up about 14% of suicide deaths. So double the rate of the civilian population.
And in your time, and you're with the Army.
I was.
Yes. How do you navigate that? How much of it is talking about it? How much of it is medicine? What do you do for these warriors?
Yeah. I mean, the history of the problem is really kind of a new thing for us. I was at formerly Fort Benning in the early 2000s, and we were seeing a really disturbing trend where the rates of suicide was increasing among active duty military, and that was highly unusual. I mean, traditionally the rates of suicide in active duty military is much lower than civilian, but that was increasing, and during wartime usually even lower. 2008, we actually had the first time in our history the rates of suicide in active duty was higher than the civilian population. So this was something brand new.
I mean, different because it was active duty versus somebody who had gone home.
Right. Yeah, and among veterans, even higher rates.
What changed? What happened, do you think?
I think what happened during our wars in Iraq and Afghanistan is we did something really different than we ever had before. Traditionally, World War II veteran, they would go to their combat deployment, they would be there until the war was over, and then they would come home. Mm-hmm. And, these two wars were so long. I mean, Afghanistan, more than 20 years. We asked our active duty to do something completely new, which was to go on deployment for a year, come back home for a year or so, go back on deployment for a year. And the stress for our military was just so high doing that. They're either winding down from a deployment or they're winding up for the next deployment. And
so it's that transitional time between, coming home and then getting ready to go back out within 365.
The stress level getting ready for deployment and coming back from deployment is very high. And basically you're always in that mode. And then you look at the stress on families. And we say in the military, our families serve with us, and that is really true. So you can imagine for a military spouse or military children having their loved one constantly in that mode. It was just so much stress on families.
Yeah, it does explain something that I hadn't, the difference between the generations, right? Yeah, that you would go and be, in World War II, you'd be there for the duration, and you come home and you could compartmentalize maybe easier than go and you just seen the kids, now you're going again, they know you're going again.
Yeah, and then something else that was really different. I mean, technology is wonderful in being able to keep the communication lines open, but again, in former wars, you would write letters back and forth, a lot of time to process. You can imagine if you're Skyping with your spouse and they're worried about finances and you're worried about your buddy that you lost a couple weeks ago. It's just different types of stress and really hard to kind of reconcile those.
Yeah, how do you navigate that? Because we want to let people communicate with their family, but I can only imagine just the regular back home struggles, and you're about to go out and do something very, very dangerous, that evening or whatever it is, and you just got done talking about the kids' school fund or whatever it is.
Yeah. I mean, it really destructive. I was at Fort Moore. We had one of our brigades of the 3rd Infantry Division was on deployment, and more than half of the married service members were actually in the process of divorce while they were deployed.
50%.
Yeah.
Wow. So what do you tell folks now, with what you experienced there? Obviously, in your position now with AltaPointe, there's still a big veteran community right here in Southwest Alabama.
There is a lot of proud veterans in our community. And again, veterans are not every veteran is hurting, but many are. And these mental health and substance abuse issues they're invisible wounds, so it's not obvious. But a lot of people are struggling, due to their service and their honorable service to our country.
Yeah, and people don't see those outward wounds. I listened to Dan was interviewing a World War II veteran who was talking about his physical injuries, but he said there's many men in here that are you can't see their injuries, but
Right.
they're suffering.
Exactly. And sometimes people have a diagnosable mental health condition like PTSD, but, even people without that, veterans without that, are still carrying the memories of things that they may have experienced during deployment that can be troubling.
Okay, this is the tough question. We'll wrap up on this, but if we have that family member, that friend, and, we're worried about them, but Dr. Engeriser, I don't want to ask them if they're going to take their life because that would put the idea in their head.
Yep. You absolutely should ask them. That is one of the myths out there is that you should not ask somebody about that. That's absolutely wrong. The most important thing to do if you're worried about someone is just ask them. And it's not a complicated question. You just ask them, are you thinking about taking your life?
But that, it's simple, but it is, when I had to overcome that as a friend and family member, that was hard. I was like, I can't ask that question. They said, absolutely, you should ask that question.
You should and you can.
That's your job.
And more often than not, the person will give you an answer that will let you know if they need more care.
It's a tough one, but I mean, it is. We love these people, so as a civilian side, that is our job.
Absolutely.
Dr. Engeriser, thank you for your service to our nation. Thank you for coming in, and I know I'll get to see you soon again, right?
I hope so.
All right. Dr. Luke Engeriser with AltaPointe, but his service to our veterans and our active duty military. Yeah, make sure you ask the question, and it's a tough one. Been there. Ask the question. All right. Coming right back, more Midday Mobile on FM Talk 106.5. We'll grab some text here at 343-0106. Plus, my friend John Young from Men United Against Violence joins us. An event coming up next month. We're going to talk about that and a whole lot more when we return.